I'm Katie Branning, and I'll be demonstrating medication administration via minibag. All right, first thing that I'm going to do before entering the patient's room, I'm going to check my doctor's orders and compare it to the MAR. I'm going to check that I have the right drug, which is ordered, and we're going to use Herceptin, the right drug, the right dose, 1 gram, the right route, which will be IV, and the frequency, which will be every 12 hours, and of course the right patient. So I'm going to check the patient's chart. I'm going to check for ALT and AST lab values. Also, I'm going to make sure that the patient doesn't have any allergies, especially any hypersensitivity or allergy to penicillin or cephalosporin antibiotics. Okay, so Herceptin is 1 gram ordered, and we're going to put this in a 50 milliliters of normal saline solution, and it's to be infused over 30 minutes with a drop factor of 10, which is on our tubing here, and that's going to give us 17 drops per minute. Okay, so I'm going to have clean hands here, and I am going to pull up 4.8 milliliters of Herceptin of our drug. To mix the solution, and I'm going to label the container with our client's name, the dosage, the drug Herceptin, the time, and my initials. Okay, next, I'm going to get out my tubing. Closed now. Okay, and I'm going to label my tubing, my name, the time, and the date. Okay, and then I'm going to prime my tubing to the end and clip it off. Is ready for our patient. All right, now I'm going to go into, before I go into the patient's room, I'm going to pull up 6 milliliters of regular saline. I'll use the flush. saline. My meds, my labels, and my MAR. Okay, and I'm going to go into the patient's room and introduce myself. Hi, I'm Katie. I'll be your nurse, and I'm going to be infusing some antibiotics for you in your IV line. I'm going to ask Mrs. White to please state her name and her date of birth to verify the patient. And I'm going to reassess the patient for any allergies, ask her if she has any allergies, especially penicillin or hypersensitivity to cephalosporins or penicillin. And the patient states that she does not. Okay, and at this time, I'm going to put on my gloves. And now I'm going to assess the existing IV site for any signs of phlebitis, redness, swelling, edema, drainage, or bleeding. Also, if it's cool or leaking, being a sign that it has infiltrated. And it does not look like the site looks good. So now I'm going to clean the pore. Now I'm going to aspirate when we get blood return, and I'm going to do push stop, 3 milliliters of regular saline, and there's no resistance. And does this feel comfortable for you, Mrs. White? And patient states that she doesn't feel any pain or discomfort. Again. I'm going to remove the saline. And now I'm going to clean the port again.
Fail. Plus they're drunk and you're getting fragile.
Clean the port again. Just open. In a comfortable spot for the patient. Infusion. At this point, I can see the blood flowing. And I'm counting for approximately 17 drops per minute. And we've got 17 drops per minute as a flow rate. Okay, do you have any pain or anything at the site? All right, the patient states that she does not, and I'm going to make sure I don't see any signs of anaphylactic skin rash or any allergy reaction. I am, as nursing implications, we want to keep monitoring the ALT and AST laboratory values. We know that this drug can be ototoxic, so we want to make sure that our patient isn't having any trouble hearing over the course of her drug therapy. I'm going to leave the room for 30 minutes until the infusion is done, and tell Mrs. White to call me if she has any problems or any drainage or pain at the site. Meanwhile, I'm going to document on my MAR the time, the date, the dose, the drug, and the route of what I administered. I'm going to state the condition of the IV site when I went in, that it was good, And I'm also going to, after the infusion, I will record the volume amount on the MAR as well as on the input and output for the patient. So I'm going to pretend that I'm going to come back in. Knock, knock, hi, Ms. White, how are you? I see it's been 30 minutes, and I'll say that the bag is done already, and she's received her Herceptin. So I'm going to clamp off the Herceptin. I'm going to have my saline ready to flush the area, to flush the IV. I'm going to disconnect the main lining. And I would put on a new alligator clip and hang the line for future use. And then I would clean the port. And I want to do a push stop flush of saline.
I called the front desk and talked to Dawn.
3 milliliters. And hold and clamp. And I'm going to remove this wrench. Depending on the hospital policy, some hospitals you would then do a heparin flush following your saline flush. Then I'm going to ask if Mrs. White is comfortable, and once again reassess for any signs of allergic reaction or side effects or adverse reactions such as skin rash, signs of anaphylaxis. And Mrs. White looks like she's in good condition, and I will ask her to call me if she needs anything or if she has any pain or drainage at her IV site.